Was in the room with President Trump when he signed the executive order on health care. She's the CEO of FASTSIGNS, a company that makes custom signs and graphics. Come on in, Catherine Monson. How everybody wants to know that Obamacare impact your business. Tell us about that.
Well, it absolutely did. You know, the higher premiums and higher taxes that Obamacare brought really impacted small businesses and the employees of small businesses probably more than anybody else. You know, there was that promise, if you like your plan, you can keep your plan. But I know firsthand that many of our franchisees' great group health policies that they had were canceled and disappeared. It certainly hurt competition.
It seems like it also hurt the ability to grow the business. It felt like as small businesses grew, the more owners it would become and the more regulatory and tax pressure you would come under.
Charles, there's no question that's absolutely true. In fact, I know several franchise owners who were at 45, 46, 47 employees and chose not to grow, not to open additional locations, not to create more jobs just because of that burdensome 50 or more employees regulation with Obamacare.
It's crazy. It's counterintuitive to the American DNA. Okay, so it's a new day and we've got a new executive order. It's not everything that I'm sure everybody's hoping for with full reform, repeal and replace actually, but this particular executive order, Catherine, how will it help you?
Well, first off, you need to know that I've been advocating for association health plans really since the early 2000s, giving small businesses the same kind of level playing fields as big corporations and even the unions have, where they're allowed to have ERISA exempt insurance, being able to provide insurance across state lines, to give small businesses the opportunity to pool their resources and then have insurance companies compete for their business because there'll be a large pool of people, is really a dream come true. But I have to tell you, executive orders come and go. Change in administration, that executive order could go away, and I really want to have a legislative solution. I'll tell you, the House has a great bill that passed in March, H.R. 1101, the Small Business Health Fairness Act. It's been languishing in the Senate, and that would be a way to lock in legislatively the opportunity for small businesses to have association health plans. Just imagine, we've got 600 FASTSIGNS franchise locations in the U.S., 10 employees apiece. We're talking 6,000 employees. If we could go to market to an insurance company to get insurance for 6,000 people, we'd get better prices, more benefits. It'd be great for everybody.
It certainly would. Can you give a word of wisdom, though, to the Senate? What's going? I mean, the Republicans in the Senate promised people like you, they promised the American public that they were going to do these things, and they're holding it all up.
Well, I have to admit that I have frustration, as well as everybody does with the Senate, but I don't see how anybody could be against association health plans, except maybe the insurance companies that like to sell the more expensive plans to small businesses. But getting millions of Americans covered with quality, affordable health insurance can only be a good thing. So I'm hoping that the Democrats join with the Republicans and pass H.R. 1101.
Catherine, congratulations and thanks a lot. Appreciate it.
Thank you.